Hello, my name is Candace Bernhardt Johnson. This is Vegas, and this video is being filmed for the purposes of my cranial sacral therapy evaluation assignment video. Vegas and I have known each other for probably 6 years now, maybe a little longer. Her owner is one of my boarders, and I also restarted Vegas when her owner originally had purchased her. Vegas has kind of a little bit of an interesting history. She was originally an Amish owned horse. I don't know what her life was like then, but after that she was a barrel horse, and unfortunately she was ridden very harshly, and developed a lot of resentment to being ridden. She was very fearful. She was not okay with being bridled. She was not okay with being saddled. She was very, very fearful of bit pressure and the rider's hands. And so at her worst, she would throw her head, she would rear, she would buck. She was just generally not a fun horse to be around. And she did not enjoy being ridden at all. Since then, she's had a complete 180, and her owner absolutely adores her and loves riding her for trail and just general pleasure. They have a great relationship, and in that time we actually discovered that Vegas had both Lyme and EPM. And the reason is because on the onset it first presented as facial tics and some neurological things going on with her face and her facial muscles. She would blink randomly. She would have twitching in her face. Her one side of her nostril would come and pull up in a abnormal way. She would also shake her head pretty abruptly, or she would almost it almost looked like she was having a seizure. And then further along, she would develop hind end weakness, and she would start dragging her hind toes. But the odd thing is we only noticed the facial ticking when she had a bridle on or halter on, or in general, if she was trying to relax, there were lots of facial twitching. So her owner and I have both agreed that because while she did go through treatment for both Lyme and EPM, and she came out on the other side totally fine, she does have some residual weakness in her hind end, and she carries a tremendous amount of tension in her poll. And for the most part, she's a relatively quiet horse, but she does get rattled pretty easily. And she still has a lot of tension up here, and from time to time she gets very apprehensive and really doesn't want her poll to be handled or touched. So it's something that we both felt that craniosacral would be helpful for. So I'm going to go ahead and get into the gait assessment. I'm going to do it at Liberty because it's a little easier to get her to move out. And then I'm going to go ahead and go into the hands-on portion. Okay, so Vegas is usually pretty forward, but sometimes it's a little bit challenging to get her to move out on a halter and lead and take video at the same time, so that's why we're doing it this way. That, and she won't hit the end of the rope and be less likely to move forward for me. So it's nice seeing her move off with the ball and use her front legs. So I'm going to watch how she moves. So I noticed when she stepped off into the trot, she almost kind of threw herself up. She did the same thing there. She kind of threw herself up, threw her head up. The walk doesn't look bad. She is tracking up pretty well, but her back is very hollow. She's very dropped.
Come on, Vegas. So she threw her head up again. There's quite a bit of tension in her neck. She appears as though she's pulling herself forward. She's relatively level from her wither to her hip, but she has a very dropped back and very weak abdominal muscles. Apparently really nice range of motion in that shoulder though. Good girl. But altogether not a very effective or efficient trot. She's very much pulling herself along. See if we can do it from this side. Come on, babe. There's a little bit of a canter. Just altogether not a very graceful way of moving. Although at the walk, she's tracking up quite a bit, but she's not engaging her rear end at all. See if I can get her to canter. Vegas canter. Good girl. So yeah, very, very stiff in the back. She's not really engaging her rear end very well. It's very heavy. Come on, babe. Canter. Good girl. It's a little bit better. Okay, so overall just she keeps throwing herself, lifting herself very, very abruptly, almost throwing herself into a trot. Let's see if we can get a canter one more time. Good girl. So yeah, very, very, very dropped, not engaged back at all. She's having a hard time going forward, very heavy on her forehand, not rounded at all. So let's see what she palpates like. Okay, so initially my first thought is she's probably got a lot going on in that hind end. Like I said, it is a continuous problem for her, and she's always had issues with her posture and general back weakness. A lot of that is conformation for her, unfortunately, but it also has a lot to do with the EPM and the damage that she sustained, unfortunately, from EPM. So I'm going to go ahead and start the palpating, and we'll see what she feels like. So since I got her here, I'm going to look at her head. Just initially, Vegas has a very small, very, very petite head. Just initially, there's no immediate abnormal reactions that I'm noting. Just palpating that TMJ, and there's no immediate reaction. No abnormal muscle development here across the parietal. I don't feel any abnormalities or, one bone being more forward or a certain direction. Nothing here with the temporal. Frontal bone seems normal. No puffiness or weepiness around her eyes. It does almost feel like the left side here of her nasal bone is a little bit further forward than the right. Her nostrils are relatively level. Eyes are relatively level. Just gonna palpate her molars and see if there's a reaction there. Back here into the masseter muscle. She's not a really big fan of that. She also does have a missing tooth in here, so sometimes that can cause a little bit of discomfort. She gets food stuck in it and things of that nature. So I'm gonna ask, or I'm sorry, let's look at your eyes real quick here. Everything looks good there. From time to time, she does deal with a little bit of allergies, so I'm actually surprised that today she doesn't have weepy eyes or, redness or puffiness. No nasal discharge, nice pink gums. I'm gonna look and see if she's got any hooks. Well, no hooks on this side. Nothing on this side. Pretty good. She's not a huge fan of me in her mouth, and a lot of that is still because of resistance to biting, although she's significantly better than she used to be. So no issues here with the set of her jaw. It's nice and straight. No over or under bite. See what she... Now, Vegas has been taught to drop her head with pull pressure. That's part of the reason why she dropped. I'm gonna play with her ears, see what she thinks about her pull. Nothing really to note there. Come down her neck. Now, the serratus muscles are very, very, very atrophied, and of course that has a lot to do with the fact that she's not really using herself properly, and we know that. But here the brachiocephalic is pretty well developed and actually a little overdeveloped from compensation. But here the serratus and splenius are very underdeveloped. Her cervical trapezius is very, very tight. Nothing really to note on the chest. No response to caudal edge of shoulder or caudal edge of the scapula. Nothing at the girth. There's a pain response here. Logismus. Heading into lumbar, there's a lot of tightness, lots of a reaction there. There's a little bit of muscle spasm going on the right side. Just not a fan of that. Right about here, right at the final ribs. There's a tremendous amount of tension right through there. The glute feels very lack of muscle tone. It's very, very squishy. Medial glute very, very loose, almost atrophied. See what she thinks about her stifle. No reaction to the stifle. Semitendinosus and semimembranosus feel normal. If maybe a little tight, especially heading towards the hock. Same thing on this side, sponneus and serratus are very underdeveloped. There's a lot of atrophy. Brachiocephalic is overdeveloped. There's a tremendous amount of tension through her neck. Nothing to note with the chest. No reaction to shoulder palpation, forearm palpation. No reaction to scapula or girth. Seems to be a bit of soreness here, but not nearly as much as on the left side of that lumbar spine. Glute and medial glute, very, very atrophied. She also has a very flat croup, an extremely flat croup. Some of that could be conformation on her, some of it could also be posture. No reaction to stifle palpation. Semitendinosus and membranosus are, actually there's less tension on this side than there is on the left. And I am going to note that she does have an area of kind of firm swelling here at her dock to the left of her tail. This is known to us. It's due to an injury, although we don't know what that injury was. However, it does not affect her ability to use her tail or move it. It doesn't cause her any pain, but she does have a tendency to carry her tail off to the right. I'm gonna go ahead and look at her legs now. No hesitation, picking up that leg. Doesn't appear to be a resistance at the knee. Although she seems to have limited range of motion here at the fetlock, side to side to side. Full range of motion at the knee. And seems to have somewhat limited range of motion at the fetlock. No resistance in extension. No resistance in picking up the left front leg. No resistance at the knee. Full range of motion. Also noting limited range of motion in the fetlock. A little bit of clicking. Somewhat limited range of motion. As I'm compressing the joint, she's not a fan of that. Some resistance with extension. Bit of resistance taking up the hind leg, hind right leg. Some resistance with extension. resistance with compression of the hop. Now extension forward, resistance extending forward. Little resistance picking up this hind leg, hind left. A lot of resistance picking up hind left. It's very heavy. Resistant to caudal extension. It's very limited, very, very tight fetlock. Clicking. Resistance to compression. More resistant at the stifle than the hop. Very resistant to extension forward. I'm going to ask that she stretch for me and see how much she can stretch. See how far she's willing to stretch. She's not willing to stretch back to her flank here. Girl. See how far back she's willing to stretch this side. There's quite a few muscle spasms going on in her back right now, although she's much, much more willing to stretch on this side. So I'm going to note the tension here on the left longissimus. I'm going to see how much lift she can get. Through her abdominal muscles. She's trying to lift, but it's obviously challenging for her. I can actually see muscle spasms right through here. Okay, so that confirmed that she's got a lot going on in her back and in her abdominal muscles, or weak abdominal muscles, lots going on in her back. Unfortunately, very weak, very, very weak lumbar. So we'll focus there. All right. Thank you for watching.